the decision of whether to vaccinate or not to vaccinate could take a toll on families. So here to talk about this with me is our Jane Marks, our mental health and wellness expert, and Dr. Lane Rowland, virologist and infectious disease expert. Good evening to you both. A lot of information to take in right there. So Dr. Rowland, we're going to start with you first. The CDC and the World Health Organization continue to stress the importance of getting vaccinated, but we know some people still have some strong fears about actually getting vaccinated. For those who are still vaccine hesitant, could monoclonal antibody therapy offer the same type of protection as a shot? What do you think?
Well, good evening, everybody, and thank you for having me on Sunday night. Beautiful program. But when it comes to monoclonal antibodies, Brittany, it is a state-of-the-art type of treatment. It's a specific target infectious diseases and also cancer treatment has been very effective. And monoclonal antibody treatment for the COVID virus itself, I think it has a proven point and can be a baseline to make the difference and stuff. It will not replace vaccination at all, but it is a state-of-the-art treatment for the initial strain of the COVID-19. I think as we get more and more with the science and the medicine over time, we're going to find out which is more effective over time. And I think it's a combination of both vaccine and also monoclonal antibody to try to mitigate and contain infection and stuff. But, you know, the bottom line at the end of the day, it's going to go back down to one thing, and that's having great biosafety security protocols for yourself. That's everything from wearing a mask, washing your hands, etc., making sure that you're tested, etc. Because the one thing that I can say for sure is that the monoclonal antibodies will only have one small part in the treatment of the SARS-CoV virus because we have so many different mutations.
And Dr. Rowland, if antibody therapy is effective, why aren't many more states offering it?
Well, one of the things is very expensive also, but you also have to understand there's a limitation to what monoclonal antibody does. When you make a monoclonal antibody, you have to understand, Brittany, is that you're making a monoclonal antibody to a particular epitope or antigen on a virus. And so if that antibody monoclonal was made for the Wuhan strain versus the alpha strain, then you're going to have an effect on the Wuhan or the alpha strain. I think in the time we will be able to see if it does have any effect on the Delta strain. And once again, for each monoclonal antibody or for each variant, you're going to have a monoclonal antibody specific because there's no monoclonal antibody that has the ability to cover every different type of virus mutation out there. And so that's why it still has a limitation. When we start talking about trying to have a game plan to have an effective treatment or protocol and procedures to help mitigate and contain the virus, we're going to have a holistic approach. And one monoclonal antibody is going to be one point, vaccines another point, masking, etc. But at the end of the day, monoclonal antibodies probably the biggest disadvantage of it is very expensive, and a vast majority of people will not be able to afford this type of treatment.
Yeah. And Jane, the decision to vaccinate or not, could take a toll on mental health, as many families are divided on this decision. Folks are downright hiding it from other family members because they are afraid of what they may say or think of them, the stigma in the Black homes. I know people personally who are actually hiding it from folks because they don't want them to say, oh man, you shouldn't have gotten vaccinated, because they don't trust the government. So what process does one go through to arrive at this point, and what impact can it have on someone's mental health when they want social acceptance by their family or friends?
You know, it's interesting because you talked about friends going through that, but I also have patients who've gone through it who have made a conscious decision to hide it from their families. You know, they're so concerned about the safety of their families, they're making these decisions to take the vaccine themselves, but because they know it's going to cause such a psychological disruption in the family, the conversations, the fact that they're going to give them a tough time, they said, you know what, it's almost better to keep the family safe, but also go ahead and get the vaccination. And a lot of kids are just coming to this. What I have found is that so many adolescents, young adults are just coming to it at this point because there was a focus on honoring the family. Mm-hmm. So when you ask the question about process, it takes time, but it also takes these young people now following the science, just like Dr. Rowland was saying.
Yeah, and why do they get so scared to be able to tell those family members that this is the decision that I've made?
Because you want approval. Don't we all want approval from our family members? Don't we want them to love us and not judge us? Don't they want us to be a part of a collective family unit that we all think alike? And so, the fact of the matter is that one of the things I tell my patients is that, look, it's hard sometimes being an adult, Being an adult means that you have to make different kinds of choices. And this time you're making choices that are going to honor your parents' safety. And so that's the message that we send, and that's the message that community leaders are sending, all over the country, because those are the persons that are going to make a difference in these families' minds. If you have your family pastor say to you, listen, let me just share this with you, they're more likely to listen than even a family member. So to get community members and to get, certainly spiritual members involved will help them sort of move the needle.
And Dr. Rowling ultimately was going back to the vaccinations here. If everyone doesn't get vaccinated, for instance, because some Americans are so fearful, what happens if we don't reach 100% vaccination rate?
Well, the reality, folks, Brittany, is that we're never going to ever get to that famous word herd immunity. That is the reality. And that's what we're trying to achieve, is getting herd immunity where we have 90% of the population has antibodies through vaccination or through natural immunity. At the rate we're going and the rate of new mutations, example, the new mutation, the C112 mutation, it's going to be a very, very long time to ever get to herd immunity. And that's just the reality, because we have so many different variant strains. That's why it's important that as a nation, as a global nation, that we have to have that big global town hall where we sit down and we explain to people the pros and cons of vaccination, why it's important for vaccination, and making sure that everybody has to be in the same boat. As long as we have a fragmented neighborhood, we have a fragmented family, half the family member gets the vaccine, half the family member does not get the vaccine, we're going to continue on this process for many, many years on this roller coaster where we're going to always have a new pandemic, we're going to have a continual new variant mutations, and we're also going to have that famous word, never ever going to reach herd immunity unless we all come together as a community.
And James, what about those people who are just afraid to get vaccinated because they're literally terrified about what may happen to them after getting the shot? What ways would you recommend coping with this fear?
Well, there really are some people, and I'm sure Dr. Rowling has heard about it, who experience trypanophobia. It's fear of needles. And, again, I've had patients who are just so frightened into going and having the vaccine that they fainted or their blood pressure elevated. And, if you're wired a certain way, some people are likely to have some immediate emotional reactions. However, if it is that significant, and if you want a family member to make sure they get that vaccination, then it's time at that point to talk to your healthcare provider, and in some cases a mental health professional, just to get you to walk through that process. When you hear what Dr. Rowling just said about what we're looking at for the foreseeable future, and as you begin to watch family members, particularly those that have not been vaccinated, again, contract COVID, some of which will survive, some won't, then I think more and more people will pivot to this, perhaps not in the numbers that we would like to see, but certainly, we would like to urge them to, make those decisions that are going to ensure the safety of their families.
Well, we know these are the things that people are talking about this weekend. I mean, this is, our second round in this pandemic with a Labor Day holiday upon us. So definitely thank you both for your time for weighing in on this, because I know everyone had these types of questions. We appreciate it, Dr. Rowling and Jane.